cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back. We're back taking your calls. Feel free to give us a ring-a-ding-ding. We're at 800-848-9222. We're live. Hey, there's another report that was out this week about that robot. I told you about the robot. The success is less than stellar. Less than stellar. Well, it's not only me saying it. There's a report out showing that their profits of Intuit, the company that makes robots is called Intuit, their profits dropped 77%. There was a steep decline in the sales of robotic surgery. So if someone's telling you about how great it is, look in the newspaper, look in the Dow Jones, look at the Wall Street Journal this week, a 77% decline. Why? Because it ain't as good as you might be being told. And people are getting nervous. They don't want to spend millions of dollars on a machine that doesn't give better results. Yeah, of course, we all want better results. That's why we publish our data. When you open up our book, you see our data. Does robots show you their data? No, because the vast majority of men who have robotic surgery have sexual problems and urinary problems, and then after that, recurrence of cancer problems. So look at the data before you make a decision. Robots sound sexy, but other people call it puppet therapy, and the puppet is not doing so well. Profit down 77%. People are staying away, and they're staying away for a good reason. It's not as promised. Not as promised. Speaking about promising, here's a man that came in this week, a very nice man, 68-year-old man, divorced, no children. He was diagnosed just a year ago with prostate cancer in April 2013 with Gleason 7 cancer, PSA 5, and he had 45 treatments. And a lot of you who deal with prostate cancer know what the 45 treatments is. Treatment. Now, this is Gleason 7 cancer. So Gleason is how the cancer appears under the microscope. Gleason was a pathologist, and rather than just telling us cancer or no cancer, he would tell us how aggressive the cancer would be, because treatment will vary. It's why we tell people our treatment, no matter what your disease, is custom tailored. It's custom tailored because not everyone should have the same treatment. Some people might need no treatment. Some might need aggressive treatment. And really, it's up to the patient. The patient is the president of the United States, of their body. The president gets to choose whatever treatment they want, but the president also wants to be informed. The president wants to know what's best, what's the side effects, how can he lick this? So he went, and yeah, people who give 45 treatments make the most money, but is that really the best for the patient? Well, if you had our booklet about prostate cancer, you'd see the data for 45 treatment therapy versus us. Now, our best treatment for a Gleason 7 cancer would be treatment in the stereotactic frame, 25 treatments, so it's about half the number of treatments, and then brachytherapy. We put the seeds in ourselves. The doctor does, not the student, not the resident, not some hidden figure in the corner. No, you know the doctor. If you come to me, I do it. And with us, our data for Gleason 7 cancer shows a 90% success rate. For prolonged, excessive, long treatment, which I think is excessive, about 65%. So you're talking about a 50% improvement in survival with better results and less time and more convenient. So this man, just a year ago, had 45 treatments in New Jersey, came in, and he was worried because his PSA started at 5, it went down to 2.2, was up to 3, and he wanted to know what to do. And he even felt guilty. He felt guilty for coming for a second opinion. Now, should a person feel guilty for getting an opinion about his life when his doctors are telling him over there the treatment didn't work? He should feel guilty? No. He should feel relieved he's coming to get a fresh second opinion, to have an analysis of his case, to see what's going on with him. And guess what's going on? I said, well, let's get a new PSA and see if the PSA is really going up or going down. Is it a 1-year spike, or is it going up, or is there an infection? Or did sex make the PSA go up? Yeah, there's other reasons for PSA to go up besides cancer. So we repeated the PSA, and lo and behold, it's now 3.9. So after those 45 treatments elsewhere, it's going up. That's why I tell people you need to get the best treatment first, because there's not always good salvage treatment. Who wants to be treated twice when you can only be treated once? So for this man, we're now giving him a course of antibiotics, make sure he doesn't have an infection in the prostate. We're checking him up. We're going about it slow and methodical. He knows what's going on. He's got copies of the reports. We have copies of the reports. I called in the pharmacy, got his antibiotics, so it's easy for him. He's taking his antibiotics now, and then he'll be back, and we'll report back to you. But the lesson for all of you is get the best treatment first. Get the data first. Understand what's going on first. Understand the options first. Don't be sorry. Get the best treatment first. And don't feel guilty about coming in. It's your right. It's your right to come in. We also spoke to him about getting low-dose CAT scan of his chest. He's a long-term smoker. He recently quit, but he smoked for many years. We talked about the data showing it can improve your survival by getting scans to stage and find lung cancers when they're small and high-risk people. That means people who are long-term smokers or ex-smokers. So he got a lot of information in an hour. I believe he's happy he came. He's following up with us, which tells you everything. So we'll report back. But again, the lesson here is get the best treatment first. First is key. Second opinion is key. Knowing what you have is key. Calling us at 212-CHOICES, 212-246-4237 is key. Hey, there's a new diagnostic test in competition to the Pap smear, just approved by the FDA this week. It was described in the New York Times. On Thursday, the Food and Drug Administration allowed for a test developed by Roche to detect in the DNA of the human papillomavirus, which causes most cervix cancer, just by taking a little sample from the cervix. Now, Pap smear looks at the cervical tissue under a microscope to detect abnormalities in the cells. That's what a Pap smear is, PAP. And women are advised to get Pap smears on a regular basis, and women should get them. But this is a different test. This test is looking for human papillomavirus, which is that virus which is widespread in our society. It's probably spread sexually. It's that virus that's causing most cervix cancer, and you can get this test. Now, Roche, ROCHE, human papilloma test, is sold by other companies, and they've been used as a follow-up test to resolve ambiguous Pap smears, or together with a Pap smear as a primary screening tool. So the new approval would allow this human papilloma test to be used alone as an initial screen for women 25 years old and older. And Pap smear would be used only in certain cases as a follow-up. So some tests have shown that human papilloma testing can result in more early cancers than Pap testing. It costs a little bit more. It could lead to more false positive, because just having the virus doesn't mean you have cancer. You can have the virus with no cancer, and there's probably millions of people who have the virus with no cancer. If something's suspicious, then you can go on and get a bigger biopsy or examination, which is called colposcopy and pap smear. This human papilloma test costs about $80. The pap smear test costs about $20 to $40. Now, right now, there's 12,000 new cases of cervix cancer a year in America, and there's 4,000 deaths, and many of those deaths are in young women. So you can do a lot of things. You can make sure your partner is using a condom to help stop the spread of human papilloma virus. You can get your pap smear, and now you get tested for human papilloma virus, and I think that you should. So women of America, unite, stop cervix cancer. It's one of those cancers that can be easily detected early and avoid death. So please do it, and do what I said. This is Dr. Lederman from 212 Choices, Radiosurgery New York, cancer treatment doctors who are happy to see you. And we have something called the Urgent Cancer Consultants, where we promise to see you within one business day, because we know that delay in cancer diagnosis and delay in cancer treatment leads to unnecessary death, leads to anxiety. Give us a call at 212 Choices. I want to talk about a case, and we'll be back in a few minutes, but I want to talk about this case first. This is a gentleman who has kidney cancer, stage 4. It had spread to his buttocks, his right buttocks and left buttocks, and we treated it last year, and it worked great. The cancer went away, the pain went away, and he was so happy. That's the beautiful thing about our treatment, is it usually works. It's non-invasive, no cutting, no bleeding. And then he got lost. He forgot about us. We were so great, all the pain went away, and he was on Easy Street. Well, he should have come back. He didn't come back. We called him to come back, and he was doing great. And now he called us because the cancer came back elsewhere while he was on chemotherapy. His chemo doctor said, stay on chemo, stay on chemo. He got started on chemo. He forgot about his old friends, the radiosurgery friends, has had chemo for a year, and guess what? Well, he's had side effects from the chemo, the cancer's growing, and finally he remembered Dr. Lederman in Radiosurgery New York, and he came in this week with progressive kidney cancer where we didn't treat. So sometimes we have to treat an area, and usually it stops or shrinks, like in him. Usually the pain goes away, like in him. Usually our patients come back. We like our patients to come back every 3 months for a checkup and a scan, or sooner. If you need us, you just call us at 212 Choices, and we see you pretty much immediately. So now he's back crying the blues because he's been on chemo. I guess he's crying the chemo blues. The kidney cancer is growing. He remembers how beautiful the radiosurgery worked. He wants radiosurgery again, and I agree. Now we're getting him staged up. The chemo doctors are just giving chemo without staging him, and it's so important to know where the cancer is. You need a baseline. No matter what treatment you choose, if you choose, and it's your right to choose whatever treatment you want, if you choose chemo or surgery or radiation or radiosurgery, you should know, is it working or not? Because if it's working, that means one thing. If it's not working, what good is it doing? And in him, he was getting chemo for kidney cancer, which you already know doesn't work very well. We know for our patients, radiosurgery works about 90% of the time where we attack the kidney cancer, even in the kidney. And we'll tell you about another kidney cancer patient after this word from our beautiful sponsor.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal, too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you